Hello, I'm Lisa Brown, Chancellor of WSU Spokane. This is the Chancellor's Update. We're talking about a spring break health mission to Guatemala. I recently had my best spring break ever, joining students and faculty on a service learning health mission to Guatemala. The participants were from WSU Spokane and Pullman and Eastern Washington University, as well as healthcare providers and business organizations from around the state. Our main goal was to assist the nonprofit organization Hearts in Motion in medical service, but that work opened a door to help with another health need, iron deficiency in the diet of Guatemalans. Each year, the annual trip involves teams performing surgeries and delivering dental care, speech and hearing therapy, pharmacy, primary care. The settings are in a hospital, a child nutrition center, and an orphanage in Zacapa, Guatemala, as well as one-day clinics set up in rural villages. This year, Hearts in Motion veteran volunteer Kathy Beerman, a WSU professor within the School of Biological Sciences, had the chance to verify that last year's work was effective. Dr. Beerman was delighted to find that a simple product introduced last year has indeed improved the blood iron levels for numerous rural Guatemalan villagers. With me here today is Dr. Kathy Beerman. Welcome, Kathy.
Hello, Lisa. It's good to be here.
Good to see you again. The last time we saw each other was on the spring break trip to Guatemala, but this was not your first trip. So tell us a little bit about how you got connected to this project.
Okay. Well, this was my fourth trip. And how I got connected to this project was through my students. I had a student, maybe 7-8 years ago, and he had a university-approved absentee letter because he was going to miss class, and he gave it to me, and I just happened to say, or to ask him, where are you going? He said, well, I'm going on this trip to Guatemala. And I said, oh, that's really interesting, and I really want to hear about it when you get back. And so when he got back, and how was your trip? And he said, oh, it was amazing. It was absolutely amazing. I said, oh, that's great, because I had been to Nicaragua, and they're very similar. And then a couple years later, I had another student who went on this trip. And when she came back, I asked her the same question, how was your trip? She, oh, it was just amazing. And I said, tell me more about this trip and who organizes this trip. And so she told me about Anna Maria, who has been with this trip for 7 years. And so I sent her an email, and I just said, I've had 2 students now who have been on this trip, and I'd really like to hear more about it. And so she graciously said, oh, made an appointment. We sat down, and at the end of the hour, she said, you need to come, in her wonderful accent, you need to come on this trip. Because Anna Maria's in foreign languages, and she wanted somebody from biology because a lot of our students on the trip are biology majors, they're pre-med, pre-dent. And so I said, really, I could go on this trip? And she said, oh, yes. And so the first year was just kind of watching, observing, and seeing people do amazing things. And then just kind of watching things, I realized, a lot of the people that we saw, diet-wise, probably had enough to eat, but not high-quality foods, and that a very starch-based diet. And so for the second year, I had the idea of bringing a very small centrifuge and just kind of testing iron status, and just to see if iron deficiency anemia was a problem in this region, and it was, no surprise. And so preparing for the third year, I started to write some proposals to maybe generate a little bit of money to buy a really nice centrifuge, which we did. And during the second year, when we tested people, we gave them iron supplements, but I realized that's a very short-term solution to a chronic problem. And so I started researching, and I came across the lucky iron fish.
The iron fish.
The iron fish.
Yes.
So when we went back, and we go to 5 new villages each year. And so the idea was that we were going to test people, and if they were anemic, we would give them a lucky iron fish. And when I contacted the Lucky Iron Fish organization, it's a nonprofit, and I just happened to mention, because the fish had been tested in Cambodia, and I said, we're going to be in Guatemala. It's a very different, foods that people eat, different diet. Would you be interested in testing that? And they said, oh, yes, we would love to do that. So they donated last year 200 fish, and the idea was that we would test everybody their iron status, and those that were anemic, we would ask them if they would like to participate in this study. And that Anna Maria gave them instruction how to use the fish, how to prepare food with the fish, how to care for the fish, how to feed the fish.
So let's talk about that part, because it might not be obvious to everyone how the iron in the fish actually can translate into improving the iron level in a human being. So how do you use the fish?
Good question. So it's kind of like when you cook with cast iron cookware, and that does release a little bit of iron, which is absorbed by the food. But with the Lucky Iron fish, you boil the fish, and which is perfect for Guatemala because they eat mostly beans and rice and corn and a lot of coffee. And so you put the fish in a pot of boiling water with a little bit of vitamin C, because vitamin C helps to make the iron that's in the fish more readily absorbed. Okay. And so you boil the water, put the fish in for 10 minutes, and then you put the ingredients, whatever it is that you're preparing. So the iron leaches out of the fish and enriches the water with the iron, and then the food absorbs the iron-enriched water.
And one of the things I didn't realize, but that vitamin C is really a critical part of the chemistry.
It is.
And how do they get the vitamin C?
We provided it for them. I mean, they could use lemon juice, which is pretty abundant in that area, but we wanted to make sure, just for the research, that it was very consistent and that everybody had the same amount, in terms of vitamin C that they were adding to the water.
And so if someone was going to try this at home to improve the iron in their diet, perhaps by cooking with cast iron, would the same thing apply, that you would want to add a little citrus or vitamin C to the water?
Right,
Great.
right. But usually with frying pans, cast iron, I guess with a Dutch oven, that would be true. But if you're just frying something, usually in a frying pan, you're not boiling water. So yes, you always want to add vitamin C, or you could add acetic acid like vinegar. Anything that's a reducing agent. It puts the iron in a form that's more readily absorbed.
Okay, so the fish get donated and you go back, and as I observed, Anna Maria and students interact with the patients while they're waiting in line to potentially have a primary care visit or have a tooth pulled, and determine that they give them the option of also having their iron tested.
Right.
And then go from there. What happens next?
So it's a little chaotic, as you saw. I mean, there are hundreds of people, and it's very hot, and they're standing in line waiting and waiting. And we have to be very careful, because especially during the first part of this study, because we have to go through consent and explaining things. And when you're taking blood, you have to make sure that the sample that you've taken goes in the centrifuge in the right tube, and it matches up to the person and all the information that you've gathered from them. So it's a little crazy in there at times. But anyway, so anybody can come and have their iron status tested. And then if they were anemic, this is during phase 1 of the study, if they were anemic, they were asked, would you like to participate in the study? And we did pay them to come back the following year. And so if they were anemic and they said, yes, we would like to participate in the study, we did some anthropometric measures. We did weight and height, so we could see if, especially with children, we wanted to see, were they underweight, were they within a healthy range? And in Guatemala, because it is a starch-based diet and because they drink so much sugar soda pop, sugar sweetened soda pop, and a lot of beans, a lot of corn, you do see obesity. You see a lot of obesity. Very high rate. So anyways, if they were anemic, then they would go see Anna Maria, or one of the students who was fluent in Spanish, and they would explain, okay, here's how you use the fish, and if you come back next year and have your blood retested, then we'll give you $5. And we sent them on their way with a fish, and Anna Maria made these beautiful instruction sheets that were laminated in Spanish, and that would help people to remember, here's how you use the fish, here's how you care for the fish, here's when you add the vitamin C. And we distributed 180 fish, so anemia rates were very high, and they were high among children, they were high in women. We didn't have that many men, because men are generally working when we're coming in and we have these clinics, and so we don't see as many men. But we did see elderly people, and that really surprised me how many elderly people were anemic. And elderly men, you don't typically see iron deficiency anemia in elderly men or women because they're postmenopausal, but we did. And so, the following year, so we gave about 180 fish. One community did not come back for retesting. What we were told is that they thought that the fish had bad spirits. And so they stopped using it. But of the 3 communities, so that kind of really brought our numbers down to about 140. And I would say anemia rates were about 40–50% of everybody that we tested. And so if we bring our numbers down to 140, we have pre and post measures on about completed everything, about 57 people. Wow. So about, not half, but close, which is really good. We were really pleased. So we came early so that we could go 4 days early before the rest of the students came for this year's medical mission. And we had 2 students with us that were there previously. And so, we flew all night. We got there in the morning. We were picked up at the airport. We went to our first village. And I was just hoping, oh my gosh, I hope people are going to come back to be retested, because everything was kind of pending on that. And we got to the first community, and we were a little bit, well, not a little bit late, we were 2 hours late, because it was so hard to get our money converted to the Guatemala currency. And we got there, and they were all sitting patiently waiting. They were so amazing. And we just got to work and started measuring people, and so by the end of the 4 days we had revisited those 3 villages, and then got ready for this trip that you were on, we went to new villages, and anybody who was anemic, we just gave them a fish, and we weren't doing a retest, but basically trying to look at what is the prevalence of iron deficiency anemia, what regions, what demographics, or the children, women, and kind of get an iron deficiency map of Guatemala.
Right. So the retest, what did you find?
Well, so we're also working with, his name is Alistair Summerlee. He is at the University of Guelph. He's also in Canada. He's also the CEO of Lucky Iron Fish. And so he did the analysis. I did the data entry, and he just sent me the analysis. You could just tell with the email he was very happy, because the results were very good. So there's 2 measures of iron status. One is hemoglobin and one is hematocrit. And both were significant. That is that about 80% of the people who were anemic during phase 1 were no longer anemic at phase 2.
Wow, that's
so
fantastic.
The efficacy was really good.
Great.
Really, really good.
So this is a global health practice that now has been tested in Cambodia and
in
at
Guatemala.
least in Guatemala, and potentially could be scaled up and utilized in other countries, or even in this country with subpopulations that have higher anemia. Are you going to stay involved with the project?
Oh yes. Oh, I love going to Guatemala. You just go there and you feel so renewed when you come back. It's the people are amazing, friendly and caring and appreciative, and you just feel like you're really making a difference in their lives. You're really helping them to feel better.
The other part that I thought was great is that the students who may be entering health professional careers, or maybe not, some were in other fields, also got exposed to research.
Right.
And research that has a potentially immediate impact on people's lives. So that was another great part of it.
Oh, absolutely. The students, we couldn't do this without the students.
Right.
We really couldn't. It is a very labor-intensive project, and without their helping hands, this wouldn't be possible. To test, 300 people a day, to take all their measurements, and weight and height, and waist circumference, hip circumference, and yes, an intake, and just to do the initial intake on people and interviewing people and getting all the information and making sure that all the numbers, their subject number matches up to the data numbers. Yeah, the students are incredible.
And the other part that I was particularly impressed by was the interest of the parents, usually mothers, in the data about their children, and their excitement about having something that could help with their child's nutrition. Of course, that wasn't a surprising thing to observe, but it was a delightful thing to observe.
Right. Like I said, they're so appreciative. And I don't speak Spanish, so Ana Maria, she's amazing, and she just has these very in-depth conversations. And so she was sharing with me that one woman said, I can walk my children to school and I'm not tired anymore, and I feel so much better now. And they were and I think they will continue to use their fish. It will last up to 5 years. That's the amazing thing about this, is that it's not just one person, it's the entire family is getting their daily requirements of iron by eating one family meal, and this will last for 5 years. So it is a long-term solution to this chronic problem. And that was the frustrating part about giving out supplements. We'd give them enough iron supplements for 3 months, and you know that when they run out, they're back where they were.
Right.
So this is really just an amazing little fix. And the other thing we're gonna look at, I was talking to my husband, who's an analytical chemist, and we just got back from a trip, and we were talking in the car, and I was looking at some publications, and they've looked at how much iron is, because you have to be a little bit concerned about iron because of, in very, very high levels, it can be toxic. And so they've done tests and look at how much iron is actually released into the water. And so I said, well, I wonder if they actually looked at how much of the iron is absorbed by the food. So Ana Maria just sent Julie and Bert, our Guatemala connections, an email, and they're going to send us some beans and rice and corn, the cornmeal flour that they use to make their tortillas. And my husband's going to analyze it. We're going to prepare it with the iron fish and without the iron fish.
Great.
And we're going to look at actually how much iron they do get when they consume the food. So I think that would be really important to find out too.
Great. Well, thank you for being here today. This is another exciting example of how WSU can have an impact on people's lives, and the education and service mission is brought home to us here in Spokane and Pullman through our participation.
Well,
so thank you so much.
I'm happy to be here, and I feel like a very lucky person to be involved with this project and with the students. It's just rewarding work, and I enjoy it.
I deeply appreciate all the WSU faculty who participated, especially Dr. Amy Meredith, Dr. Lisa Woodard, Dr. Ana Maria Rodriguez, and Dr. Kathy Beerman. These women not only devoted their spring break to mentoring students, but also took time to show me the ropes and include me in the work and the fun. A special shout out to Spokane oral surgeon Dr. Mark Paxton and Seattle businessman Howard Wright, stellar Coug alums who have participated in and supported the trip for years. I've never been more proud to be part of this university. The trip allowed me to experience WSU's commitment to service and team-based healthcare firsthand. Seeing our students working together to care for people in rural villages who don't have secure access to care, learning side by side with our dedicated faculty, and having enough energy at the end of the day to stay up talking all night and play soccer with the children the next morning was truly inspiring. Thank you for watching Chancellor's Update from WSU Health Sciences.